My name is Andrew Sherman, and I'm the Chief of the Department of Cardiac, Vascular, and Thoracic Surgery, and I've worked at St. Joseph's Hospital for 11 years. What makes our Heart and Vascular Institute special is a team of physicians coming together with one focus in mind, and that being the patient. Our team here at the Heart and Vascular Institute includes pediatric cardiologists, pediatric interventional cardiologists, adult cardiologists, adult interventional cardiologists, adult cardiac surgeons, electrophysiologists. There isn't a physician involved with cardiovascular care that you cannot find in our institute. The history of the Heart and Vascular Institute is interesting in that we had the opportunity to travel around the country and look at how other institutions set up their centers. And what we did here is we chose to have all of the physicians behind one sterile line, so that when we physicians arrive at the institute, we pass a sterile boundary where the electrophysiologist, right next to the interventional cardiologist, next to the pediatric cardiologist, next to the adult cardiac surgeons, where we are intimately involved with each other's care. We can stop in each other's rooms and go over scenarios, cases, patient care, outcomes. We're continually and constantly collaborating with each other. In the past, you may have had a patient who would have to travel not only to a different area of a floor, but in elevators to different areas of the hospital. Now it's all centered in one location for patients to receive all of their cardiovascular care. The Heart and Vascular Institute offers some of the most advanced and innovative procedures in the area, or for that matter, in the country. We have state-of-the-art hybrid operating rooms. A hybrid operating room allows us to perform some of the most technically advanced procedures because it's a fully functioning catheterization laboratory and a fully functioning operating room. The procedures performed at the Heart and Vascular Institute range from pediatric cardiology to pediatric open heart surgery to electrophysiology to the full gamut of adult cardiology to the full spectrum of adult cardiac surgery. We have technically advanced consultation rooms, conference rooms, patient areas, just about everything that's related to cardiovascular disease. One of the things we're most excited about is the minimally invasive options we have for patients with valvular heart disease, specifically TAVR, or transcatheter aortic valve replacement, where we're able to put a brand new aortic valve in with mini incisions. We have a minimally invasive procedure to treat patients with atrial fibrillation called the convergent procedure. We helped design this procedure. We help physicians all over the country learn this procedure, and we feel we've really extended the opportunity to help patients in our own community. Our multidisciplinary approach to patient care allows patients to get the opinions and see multiple physicians in one location without having to piecemeal it together. Our team here at the Heart and Vascular Institute includes pediatric cardiologists, pediatric interventional cardiologists, adult cardiologists, adult interventional cardiologists, adult cardiac surgeons, electrophysiologists. There isn't a physician involved with cardiovascular care that you cannot find in our institute. Being a part of Baycare allows us to collaborate with multiple different physicians across multiple different institutions so that we can all share outcomes and experiences so that we can learn from each individual hospital's expertise. In addition, Baycare allows us to share quality across the institutions so we can all have opportunities to provide great patient care. Baycare's cardiac surgery programs have received the highest distinction by the Society of Thoracic Surgeons, that being a 3-star rating.